Assalamu alaikum. My name is Dr. Syed Asif Shah. I am a consultant plastic surgeon, mostly doing cosmetics in my private practice. I wish to talk about aging face, which means after the age of 40 or 50, the skin starts sagging, starts going down because of the effect of gravity. It also starts losing its substance, which means its thickness, its shine, its luster, which is caused by thinning of the skin. So we do now understand that there are two components to facial aging. One is the hanging or the sagging of the skin plus the muscles, and the loss of quality of facial skin. So I'm sure you would have guessed by now that in any age reversing procedure, these two components needs to be addressed. For the sagging skin, there has to be some form of surgery. If the sagging is in the middle face and you are a victim of only smile lines or jaws, then what we do is mid facelift, wherein we give incisions just below the eyelashes. We lift the skin along with the muscles. That is known as mid facelift, and it can be complemented with fat grafting, which is usually taken from the lower abdominal or the buttock region, because that fat is reasonably reliable. The other procedure that we can do to reverse the aging or the sagging of the skin is to go around the hairline and around the ears, wherein we just pull all the facial muscles in an oblique manner, and below the skin are the muscles of the facial expression. We also tighten that layer. That layer is known as SMAS, S-M-A-S, which represents the facial muscles, and a layer over that is known as the deep fascia. When that is done, that is the most excellent procedure that a plastic surgeon can do for you, because the sagging, when it occurs in both the planes, in the dermatological and in the muscular plane. So when we address both of them, that gives a very optimal, very decent result. And again, it can be complemented or improved with the addition of some sort of fat grafting that again can be taken from the lower abdomen or the buttock region. We can also use fillers and other stuff to give volume to the face, because in certain population of patients, it's not just the sagging of the skin. There is also reduction of the bony skeleton, and we call it, for simplicity, volume loss. So that lost volume needs to be replaced, and it can be done with the techniques that I already mentioned. Finally, once you are done with the surgeries, then we need to improve the quality of the skin, because the first component, if you remember, was just repositioning. We have done that. Now we want to increase the thickness or the quality of the skin. That can be done with so many products, so many lasers, so many procedures. The best that I like are lasers, something like fractional lasers, because it improves the quality, it increases the thickness of the dermis, and it reduces the pores, it reduces the color irregularities. And mind you, these are not the only procedures for facial rejuvenation. There can be others, like if the forehead has come down, which is known as brow ptosis, it can be lifted with brow lifts. Likewise, upper and lower eyelids can be improved with procedures known as blepharoplasty. And it's one point that I would like to emphasize here is that not everybody is a candidate for all the procedures. It's when you walk into the clinic, we do a detailed examination, we do a detailed interview, preferably 2 appointments, and then we make the final list of the procedures that are required for any particular person. So it was just a brief about anti-aging procedures. If you have any questions, any queries, you can write down in the comment. You can call us on the given numbers, you can email us, and we'll try to get back to you with your relevant answer. Thank you very much.